There are two methods of placental separation. They are very important because one of them plays a role in excessive postpartum bleeding. The first one is, occurs in 80% of scenarios, and this is, I don't know how to pronounce this correctly, but this is, I think, Schultz method or the Schultz's method. So this Schultz's method is also known as the central method of placental separation, and this is, it naturally occurs most commonly. And then we have the marginal method of placental separation. This marginal method is also known as the Matthew-Duncan method. Matthew-Duncan method. Okay, so why am I mentioning these two methods? Thing is, okay, let's just suppose that this is the uterus, okay, and the placenta was, let's say, present in this whole region. This is the whole, the placenta. Now if this placenta separates, in the central region, what will happen is that over here it will separate and come forward. Over here blood will accumulate behind the placenta, okay, and this is known as a retroperitoneal hematoma will form, or a retroperitoneal hemorrhage will occur, okay. And so the blood will, stay behind the placenta, and so pph chances will be lower. It will not, seep out freely because there is a placenta in front of the, the released blood. And how will you know that the central method of placental separation has occurred? Now these two things, they occur naturally. This is not in our control whether central separation will occur or marginal will occur, though central occurs more commonly. So in this case, what will happen is that the fetal side of the placenta comes out of the introitus. And how will you identify the fetal side? It is the shinier side. In layman terms, it is the shinier side and the more glazed side. So whenever, a mother delivers the baby and the placenta comes out and you see that there's a shiny side has came out, then you can say that the placenta has separated from the central method or the Schultz's method. And this is, a good thing because in this case, the chances of postpartum hemorrhage are lesser. Now, the second one was a marginal method. Let's say that this is the uterus and the placenta. It starts separating, from the margins first, from this portion first. The other portion is, intact. So when it starts from the margin, the blood will directly come out. There is nothing in front of the blood to stop it from seeping out. In the central method, there was placenta in front of the blood because, the central portion was separated, so blood was present behind placenta, so it prevented it from seeping out. But over here there is nothing, so the blood will directly come out from the marginal regions. So in this case there will be very high chances of pph. And how will you know that marginal method or Matthew-Duncan method has occurred? The maternal side of the placenta will come out, which is, basically known as the, the dirty side of the placenta. Is rather dirtier, it is not shiny. So these are the two methods of placental separation.